Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural healthcare headlines. We'll cover 3 headlines in today's episode: what's most urgent, a healthcare damage report, and a success story to send us into the week. First, what's most urgent. On Thursday of last week, the Senate failed to pass legislation that would extend enhanced premium tax credits for ACA marketplace health plans or reach any kind of compromise between the parties. As anticipated, healthcare costs will skyrocket for the current 21.8 million enrollees, and we expect to see a record low in marketplace enrollment this year. KFF estimates that the expired subsidies will cause annual premiums to more than double, making health plans completely unrealistic for many Americans who will now be paying out of pocket. By creating a payer population that lacks proper reimbursement for hospitals, we're not putting money back into the hands of American people or even healthcare providers. Hospitals will suffer under the effects of this decision, especially those with a historically high rate in marketplace payers. We'll review one more urgent health line this month. Health and Human Services repealed a rule that required long-term care facilities participating in Medicare and Medicaid to provide residents with a minimum total of 3.48 hours of nursing care per day with additional specific requirements. While nursing homes want to adequately care for their residents, this rule disproportionately burdened hospitals that are facing healthcare workforce shortages. With everything else going on in healthcare legislation, we're grateful for this win. On to the damage report. Let's return to an issue we covered this fall. Healthcare systems and industry leaders have been eyeing the new $100,000 fee attached to each H-1B visa as a potential recruiting challenge, and now rural health is feeling the impact in real time. Some hospitals in remote areas rely on international programs that bring foreign-born healthcare professionals to the United States. H-1B visa recipients, they fill open positions for doctors, nurses, technicians, and other roles that are essential to patient care. Now, rural hospitals are the most vulnerable in the face of visa fees because most big urban health systems offer sign-on bonuses and other perks that rural hospitals simply cannot afford. Of course, working in rural health providers are unmatched opportunities to be part of a family, care for a community that you love, grow in unique ways across your field that aren't possible in larger systems. The larger systems present silos. Yet rural hospitals struggle more to find talent locally and have to look outside the U.S. to support their team and patients. With resources spread thinner than ever across rural hospitals, many will sustain long-term damage from having to choose between a staggering fee and remaining short-staffed, which, of course, impacts patient care in addition to the strain on hospital employees. According to a report from the Health Resources and Service Administration, rural areas will be experiencing the greatest staffing shortages as overall rates of shortage increases across the U.S. By 2037, HRSA predicts a shortage of more than 187,000 full-time physicians alone. A 2023 government survey revealed that 16% of registered nurses, 14% of physician assistants, and 14% of nurse practitioners and midwives working in the U.S. are immigrants. As of last year, around 25% of physicians went to medical school outside the U.S. or Canada, according to the Federation of State Medical Boards. We're following the lead of the American Hospital Association and other industry leaders urging the Trump administration to exempt the healthcare workforce from the $100,000 H-1B visa fee. And now for the success story. Rural communities are considerably under-resourced compared to their urban counterparts, and one of the most significant needs is childcare. Data shows that more than half of Americans live in communities that are classified as childcare deserts. When parents can't find affordable and accessible childcare for their children, they can't consistently work which they cannot support their families or contribute to the economic development of their community. This also affects the population of rural areas, as families with young children can be prevented from moving to a rural area because of the lack of those resources. Many experts predict a declining rate of longevity for rural communities as long as childcare access remains inadequate. In rural Jasper County, Indiana, a critical access hospital turned their former admin building into a childcare center. In the midst of the COVID-19 pandemic, most administrative staff were working remotely anyway, and the building was empty for several years, but the Franciscan Health Hospital partnered with a nonprofit child center called Apple Tree to lease the space and provide childcare for all of the hospital staff. This is a growing trend for rural hospitals and staff as they express the need for childcare services, and they struggle to make a hospital work schedule fit with their inflexible school or daycare calendars. Understanding how needs like this fit into the rest of the community is vital for a hospital that wants to support its teams and provide the best care possible for its neighborhood. As other rural resources disappear during the funding cuts across the U.S., we know that hospitals in rural communities will continue stepping up as long as they can to support their communities with needs like childcare, food security, crisis readiness, and more. Thank you to our sources for this episode: the American Hospital Association, The Guardian, Health and Human Services, KFF Health News, Federal State Medical Boards, Visa HQ, Rural Health Information Hub, American Progress, and the Daily Yonder.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.